My name is Josiah Northern. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. Today we're going to be going over intravenous therapy. Before you begin the skill, you want to make sure you have all your equipment set out and ready. This includes body substance isolation, gloves, and eye protection. The fluid that we select, you want to make sure it's the appropriate concentration, and you want to make sure that it's clear of any particles and not expired. Our intravenous tubing for the fluid, you want to make sure that it's not expired and it's the appropriate drip set. We want to select the appropriately sized catheter. We want to make sure we have tape. If we're going to be drawing bloods, we want to make sure we have a blood tube kit set out and ready. We want to make sure we have plenty of 4x4 gauze pads, alcohol preps in order to clean the site, and a tourniquet. And as always, we need a sharps kit out to dispose of any sharps after the procedure. So now that we have all of our equipment set out and ready, we're going to perform the skill. Adam Gallegos, he also works for Castle Rock Fire, is kindly enough to step in and be a patient for us. In your skill station, you might have a mannequin arm or a dummy arm you'll be using. So we want to connect our IV tubing to the IV fluid. We also want to pre-fill the IV tubing with fluid so we don't introduce air into the patient's bloodstream. Once the tubing's pre-filled, we can shut it down. You'll get points for pre-cutting your tape and having it prepared. And then we'll apply the tourniquet. Using our alcohol prep, we'll clean the site in a circular motion. You can use as many alcohol preps as necessary until the prep is clean and free of any dirt. With the appropriate angiocath, we'll perform the skill. When you're ready to perform the actual procedure, you'll get points for inserting the stylet, verbalizing or visualizing a flash into your angiocath, applying tamponade proximal to the catheter, removing the stylet, putting it in the sharps container, and then connecting your IV fluid. Flash. Removing the stylet, holding tamponade, connecting your blood tubing, and removing the tourniquet. With your pre-cut tape, you'll secure your IV. And then select the appropriate drip rate. After we've selected the appropriate drip rate and let fluids run for a minute, we want to make sure and dispose of our angiocaths and needles into appropriate sharps containers. And this concludes the intravenous therapy scenario.